To everyone who's joining, we'll start in a minute or two. We're just waiting for everyone to keep joining. So thank you. So hello, everyone, and thank you for joining us today for Food Tank's listening session in the lead up to the White House Conference on Hunger, Nutrition, and Health. The title of our listening session is Dismantling Silos to Strengthen Nutrition and Food Security Research. I'm Dani Nierenberg, and I'm president and co-founder with Bernie Pollack of Food Tank. We are a research and advocacy organization devoted to highlighting stories of hope and success in food and agriculture systems, both internationally and domestically. And we hope to motivate, inspire, and activate positive change in our food systems. This September, on a date that will be determined and hopefully soon, the White House will host the first conference on hunger, nutrition, and health in more than 50 years. The last one was in 1969. During this historic conference, they will announce a strategy, we hope, to end hunger and improve nutrition and physical activity. Today's conversation, again, is focused on one of the conference's main pillars. There are 5 pillars, and this is around enhancing nutrition and food security research. And so over the next hour, we will hear from really wonderful experts, as well as many of you in the audience, about solutions to improve nutrition metrics, data collection, and other kinds of research to inform nutrition and food security policy. And we will discuss the importance of ensuring that this research is informed not just by members of the academic community, but also by the experiences of communities impacted by poor nutrition and food insecurity. Inclusivity, as well, is something we all know needs to be a key part of research moving forward, so that we have a truly equitable food system that nourishes everyone. Following today's event, we will compile the main takeaways from our conversations into a formal report that we will submit for the White House's consideration. Stakeholder input, again, as you all know, is essential to this process, and we want to help ensure that the White House's national strategy is, again, inclusive and equitable. And to do this, we are relying on many of you in the audience to inform our submission, and after each panel, we will open the floor to responses. Before I introduce our first panel speakers, if you're interested in responding to the points raised following our panel discussion, please raise your hand in Zoom, and Elena, who is our contact director, will help me figure out who to call on, and we'll try to make sure we do it in order. To help ensure that we hear from as many of you as possible, I am asking everyone to keep your remarks to 60 seconds or less, and I will time you. So now that we have all that housekeeping out of the way, I'm excited to introduce our first panel, who I hope will join me on screen when I say your name. First, I'm thrilled to introduce Riana Lynn, the founder of Journey Foods. We are also joined by Marion Nestle, the Paulette Goddard Professor of Nutrition, Food Studies, and Public Health, Emerita at New York University. And we have Tambra Raye Stevenson, the founder and CEO of WANDA, which stands for Women Advancing Nutrition, Dietetics, and Agriculture. So welcome to you all. It's so great to see some of my favorite people. So I want to start with you, Marion. When we last spoke about this conference that the White House, says they're going to have, you mentioned that many of the conversations around the conference are failing to ask the right questions. And so I'm really interested in what you think are the right questions. What do they look like, and what is getting in the way of asking the right questions?
Well, the right question, seems to me, is the view from 35,000 feet, which is, if you want to solve problems of poverty, what do you do? Well, to me, it seems very simple. You establish a universal basic income. Everybody in the country gets money, and that they can spend on anything they want. And guess what? They're going to spend some of that money on food. Right. And we know this because when President Biden established what was essentially universal basic income during the pandemic, people bought food, food security went down. What a surprise. What a surprise. So you do things like universal basic income. You have universal school meals. Let's just feed kids in school and stop this nonsense about having to set up criteria for who's qualified and who's not qualified. Kids need to be fed. Let's feed them. Let's feed them healthy food. I mean, really simple things. But
Sure.
what I'm not seeing is that kind of 35,000 foot view. In the listening session that I was in, we were asked to focus on programs specifically. And yes, the reasons for doing that are very clear. Politics is in the way of that. Universal basic income has a long history of political opposition from people who think that people will spend all that money on alcohol and drugs and not feed their families. And, I don't know what we do about those kinds of attitudes. But I think we're a very rich country. We could do this.
Absolutely. And I'm glad you brought up the issue of poverty here, because I think that's something that we're not talking about enough when we talk about hunger, ironically. And, when you talked about this universal basic income and why there's opposition to it, and I think part of it is inherent racism. And that's, we don't want to provide people with the resources they need because we're afraid of what they'll do with it. And you mentioned, spending it on drugs or alcohol, and that is awful. So, thank you for bringing up those points. I think it's really important to center this discussion around this issue of hunger and poverty. And so, Tambra, if I can turn to you and sort of switch gears for a second. According to the Commission on Dietetic Registration Demographics, only around 3% of registered dietitians are Black. And I'm wondering how you think this affects nutrition research, how we talk, how we bring poverty and equality and equity in these conversations, and what are some of the biggest barriers to diversifying, nutritional research and how we look at these issues?
Thank you so much for that question, Danny. And to the point of, and I want to piggyback on what Marion just talked about, what we need to be thinking about in the grand scheme of things is how do we address food apartheid by acknowledging that we must acknowledge the need to have a food democracy where everyone sees themselves as a food citizen and have a seat at the table. And right now, our communities, particularly those of color, Indigenous people, we have not been on the table. We've been on the menu. And we need to understand that to address food apartheid, it takes an approach, one, recognizing nutrition security is national security. And just like preparing for war, we must have the equipment, the troops, and the infrastructure in order to win the war. And that means those of us who have gone through the field of nutrition and dietetics that represent, let's say, less than 4,000 Black dietitians in this country, that is not enough people to win a war that is impacting our communities that are nutritionally divested through structural barriers, and understanding that policy along with media are two key determinants of health. How we shape the discourse as we're having today, whether it's offline, online, and also how that discourse shapes public policy. And so I'm grateful to have this conversation because this is why we see the need to create a Bill of Rights. In the coming weeks, you will see from WANDA an opportunity to endorse and engage and be a part of what does our future policy foundation built upon. And it needs to be a set of values that recognize that in order to shift the system, we have to value everyone having a seat at the table. And so that involves, one, having a loan repayment program for RDNs that does not currently exist as it does for nurses, doctors, and PAs under HRSA, their health services program that deploys folks in medically under-resourced communities and pay off their loans by doing so. So that means my community of Anacostia or the Bronx or Compton, these communities would have the troops on the ground to help equip the communities with the resources they need that couple the grocery stores that need it. We need the teaching kitchens, we need the community gardens, we need the cultural competent nutrition providers and the content that reflects and empowers communities and not weaponize their food culture against them, but to say my Black food is my medicine is part of identity, power, and culture. And that has not been fully talked about and shaped in this food as medicine conversation, but that is part of the critical conversation we must have, and that conversation must turn into a funded policy mandate, whether that's HHS, USDA. They must modernize their federal nutrition programs and ensure that technology is a key driver to that and culture is a part of that if we want to democratize nutrition for all. Thank you.
Thank you, Tambra. There's so much that you brought up, including, the infrastructure that is needed, the values that we want to portray when we're talking about this, and not weaponizing people's food culture against them. There's so much to unpack there. I hope we can come back to some of it, but thank you so much. I don't know if you can see the comments, but it was like, yes, Tambra, yes, Tambra, yes, Tambra. So thank you for sharing all that. Riana, if I can come to you now, Journey Foods and sort of your whole life has been devoted to improving nutrition in underserved communities. But there is this huge lack of data and information about what is nutritious. And as Tambra brought up, what is culturally appropriate for communities? And I'm wondering if you can talk a little bit about that, and how does the funding affect the type of nutrition research we see today?
No, absolutely. And I just want to say that I'm very pumped up by the words of Marion and Tambra. For me, I always think about the fact that we need to go back to the ground of where our food is both being produced and where the people are that are consuming the food and how they're showing up, again, as you said, Tambra, at the table. And so that means that I just want to start by saying, we need to have these conversations with students and with teachers and parents and with grocery store and corner store owners so that they can shape the policy as well and also shape the data that's going in. For me, as I show up oftentimes as an entrepreneur in the food industry, as a data scientist, as running a data company, where we often see that the personalized nutrition, the data around what will soon be a $1.1 trillion packaged food industry, growing rapidly, especially as the restaurants continue to suffer. These are things that make up 70% of our daily caloric intake is packaged processed food. And so on the side of CPG, of food manufacturing, of really the access around what is built into our school systems, food service, as well as what is the most accessible to us, which is grocery store, corner store, and now delivery food items. We need to make sure that the data around not only urban communities, but also rural communities of the most impoverished, but also looking at how how food consumption is affecting our daily lives. I think that we have a very outdated and a very racist sort of driven food policies around like everything from our daily caloric value intake to our daily recommended values of nutrition that we need to look at. It's also sort of one size fits all. And there's a lot of data that shows that most of the food that we're subsidizing around the country is killing, everything from the dairy intake that we have to causing large amounts of chronic disease, all the way over to the effects that we have on mental health and even things like students being able to focus in school. And so there's lots of data that is now available that shows that we both have cost and supply chain issues, but we have very, very direct evidence of how foods affects our bodies. And we're not doing enough to change not only which types of foods we're subsidizing and which types of programs we're subsidizing, but we need to take a direct action against the food manufacturers and our food recommendations that are really driving the way that school lunches and school programs are set up, the way that we're thinking about how to communicate through media our daily recommended meals And finally, I became an entrepreneur after spending time at the White House, spending time in policy, spending time, doing chronic disease and DNA research, because I believe that entrepreneurship and the folks that are making the food have the fastest pathway to changing what is consumed every single day, right? We have entrepreneurs that are underfunded. We have Black entrepreneurs that are looking to create new foods that are culturally relevant, but also healthier. And we need to find ways to make sure that not only the food policy and the food recommendations are better, but that our government is supporting innovation, data, and entrepreneurship. And that's how we have the most change, I believe, in this country.
Thank you so much, Riana. Again, a lot, you said a lot, there's a lot to unpack there, and data is so important to this, and research is so important to this. So I want to ask a question to all three of you, because you've all brought it up in different ways. How do we make, and it's a very simple question, but very complex at the same time. How can we make nutrition research more inclusive? How can we make it so that it's not just about, what will be the best, sort of thing that looks like, that isn't on a nutrition label, but that actually nourishes people, that actually makes them healthier and live better lives. So Marion, what would you like to see to make nutrition research more inclusive?
Well, I think we need interdisciplinary research, much more interdisciplinary than it has been in the past. I have to say, I wasn't trained in nutrition. I was trained in molecular biology, and I bring a very science-based approach to looking at nutrition research. But I don't think that you can understand why people eat the way they do or what they eat unless you understand sociology, anthropology, economics, history, and a lot of other things as well. And we're not training we're not training nutrition practitioners. We're certainly not training dietitians. We're not training nutrition scientists to have an interdisciplinary perspective on the kind of research that we're doing. And I think we need to do that.
Absolutely.
Thank you. I'm not sure that's easy, but I think it's what's needed.
No, and I do think it's what's needed. It's very important that people have a wider vision for all of this. Tambra, what are your thoughts?
Well, first, we know that NIH has the Nutrition Research Institute, and there will be hundreds of millions of dollars in that budget. The question is, will they be appropriately distributed to HBCUs, as it will be to land grants institutions, tribal territories, and we have to acknowledge that, one, we need to have the mechanism, a board that reflects the diversity that we want to see in the research. So that means representation from all those institutions, the Hispanic serving, HBCUs, tribal colleges. They should be on the boards that help govern and determine what should that nutrition research agenda. Also, the USDA HHS 5-year research plan has not included African foods, Black foods. And so understanding that, what is the mechanism to ensure that in that plan that's turned over every 5 years, like our DGAs, that we have representation from the community and from professors to be able to talk about, these are the foods that need to reflect to help heal our communities, because this is how we get Mediterranean diet repeatedly at the top of US News every year, because someone allocated money and said that this is the diet that we all need to eat. We are not monolithic people. We should not have a monolithic diet. And last time I checked, the Mediterranean touched Africa too. So why is that not a part of the conversation? So we have to acknowledge, when we look to shift food culture, we're shifting economies that are the underpinning of that food culture. So when we demonize the foods of Miss Effie May in our community, we're saying, Effie May, your food is not healing us, but we're not training her to be that healthy food entrepreneur. And so in the state of Oklahoma, I just visited with Carrot Con Flavors in Northeast Oklahoma City, where they have a certified healthy restaurant where they're serving Trinidadian food and African-American soul food. And they understood that we have to find a balance between what the community wants and what we need to keep them alive. If we can model more programs like that, where certifications of healthy businesses, healthy hospitals are implemented, and having the evidence-based practices, we can scale up and change the culture in our communities. And that is the level of practical evidence-based research that we need to see in this country.
Thank you so much, Tambra. That was great. Thank you. Riana, we have a few minutes to wrap up this section.
I mean, I think that even with the recommendations that are coming out, I mean, spending hundreds of millions of dollars on nutrition policy is just not enough. I mean, when we think about over the past 70 years, what we've spent on R&D as a country, and everything from weapons of war to top scientific breakthroughs to our food, we're down, 60% compared to what we used to be as a thriving leader in R&D. And I think one thing is we need to continue to push for more support of our sciences, but we need to integrate a lot more. It's a very broken research when you're not also looking at supply chain data, cost data, working on finding things that are cost efficient and really fixing those problems. We can't keep recommending things because they're cheap and because it's something that worked 20, 30 years ago. Our research system is broken as well as underfunded, and we need to think of ways to empower people to think more entrepreneurially in this system, and also make sure that we're thinking a lot more economically, because traditionally our scientists and policy researchers don't have the understanding, not only cultural sensitivities and inclusion, and making sure that we're personalizing for the breadth of diversity that we have here in this country, but we're also not thinking about the fact that we're creating systems that are unsustainable, that are not regenerative, and that are not going to continue to solve for a lot of the debt that we're putting ourselves in every single year. And so the intersectionality and the change and sort of the pioneering research is quite lost here. And I think we need to make sure that we understand, as was said earlier, nutrition security is national security. We need to make sure that we're investing in the more of a pioneering nature of our food. And it needs to be at the top of the list, as it's something that we need every single day.
Absolutely. Thank you so much. We've heard so much about intersectionality and inclusivity, but I really like what you had to say, Riana, about, more pioneering in how we think about food and thinking about things very differently. So I want to take a pause here. Thank you to all of our panelists. Please stay on screen. Before we move on to the next panel, I'd like to invite some members of the audience to respond. And please remember that we're asking everyone to keep their comments to about 1 minute each. So I see that my friend Chef Pierre Tiam of Yolele Foods is here. And so I want to invite you, Chef Pierre, to react to some of the points discussed during the panel.
Hello, everyone. Hey, thanks for inviting me, Danny. It's such a pleasure. I mean, listening to the panelists and my friend Tambra, I mean, it was just powerful. And the answer is there. I mean, they really figured out how to fix this food system. Everyone, I mean, Marion is right. Basic income is necessary. I mean, it makes sense. I mean, we have the means to do it. School meals is just also something that is so important, because kids need to be educated, not only to have access to good food, which is food that's really grown in a sustainable way and that's nutritious, but also how to cook. I think that should be part of the curriculum, teaching kids how to cook. And that's a skill that will be so important throughout their lives. I think more important than economics or math or anything else. I mean, that's really a basic skill that I believe should be part of it. And again, the breaking the silos, this approach to this panel is really the way we need to think to change the food system. Everyone needs to have a voice. It shouldn't be only about corporates' bottom line. It should be nutritionists have a voice, farmers, small farmers have a voice. And like Raye said, the subsidies should go to small farmers, and we should take the data. Science should be part of the thinking process of it. But really, kudos. I love the panel. I love everything that you had to say, and thank you for inviting me to join.
Chef Pierre, that was great. I agree that we should bring home economics back and teach people to cook again. So thank you for sharing. I also want to invite Darcy Cook of the Maine Network of Community Food Consoles to respond as well, if you're available, Darcy, if you can come on screen. Thank you so much. What are your thoughts in 60 seconds or less? I know it's hard.
Hi, thanks for letting me join. This is wonderful. I strongly agree with so much of what I'm hearing. I guess I kind of want to add to the conversation that I'm a community organizer. And so when we're talking about how to best collect data and learn how to fix our food system, I think the best, most accurate information we're going to get is from people working within their own communities, mutual aid groups, neighborhood groups, and sometimes it can be hard to pinpoint the folks that are doing this work because we're not all established 501c3s with websites and formal networks. But digging in and really finding those small groups spread throughout our states and our country that are doing the work within their own communities, they're going to be able to give us much more accurate information because a lot of people are not going to answer a survey about their experiences with food insecurity, but they'll talk to their neighbors and their friends about it. So I really appreciate you all's time, and that's all I got. Thanks.
Thank you so much. That was great. And someone wrote in the chat that, you know, the semantics really matter there. And I think that's part of what you're talking about, you know, identifying the people in communities who are already doing this work and talking to them. So thank you. Now if if Angelica Valdez Valderrama of Tufts, if you would like to respond, it would be great to hear from you.
Hi, it's an honor for me to be here. I am a fellow academic, and I'm really excited to be in a place where people are talking about exactly what I'm looking at, which is I'm specializing in nutrition security, but looking at the equity aspects. And one thing that I'm really focused on is how we can break apart the actions that we take, the programs that we implement, the models that we use also to make these decisions, the assumptions of the existing things, while also making sure that we move forward equitably with any changes to our programs and policies. I feel like that's a tension that I've tried to hold and that I see as being really important moving forward. And so something that Marion said that really sparked a lot of similarities to my work is thinking about how prescriptive we are and how much we want to tell people what to do, which is something also that Tambra and Riana were mentioning. Less prescriptive is equity, thinking about trusting people to make the right decisions, allowing people to have agency. That part is extremely important. And cash transfers have been shown to be better policy than showing up and making people have specific programs or following specific rules. And something else that has been mentioned was in terms of barriers to diversifying research, nutrition researcher, who is in the room matters. And as Tambra was saying, it's not just about showing up and being at the table. It's about where is the funding going? It's about who is making those decisions about where the funding is going. It's where the boards, where the leadership centers, how are we integrating historically Black universities and colleges, Hispanic universities and colleges, and other people that have been relegated to parts of the food system that have always been in service and not in making those choices. So yes, it is about democratizing, and yes, it is about listening to people and who is there and how they're able to talk about things. We do need to do things differently. And if we want to talk about changing, making major changes to nutrition research, we need to talk about changing the criteria for entry, about funding, and about things like the qualifying exam in PhD programs. So there's things that we can do at all different kinds of levels that I think we can definitely move forward.
Great points, and along with that, philanthropy needs to change the kind of funding. But you said two things that really stood out for me, and that it's the words democratizing and trust. We need to trust people to make their own decisions, and I think that's great. So thank you so much. I'd now like to invite Amelia Gelnet of Johns Hopkins University. I'd really love to hear if you have any thoughts on this.
Hello, thank you for having me here today. Very much appreciate this invitation. I'm in complete agreement with my prior panelists and appreciate the input. Currently, what stands out to me is that there are so many avenues to which we need to improve our health system and the ways in which we are engaging people in nutrition, particularly upstream, because there is such a differential in especially income between individuals that we're serving and individuals that are leading these causes. And that is causing a huge divide in understanding what will actually aid them, especially things like culinary tools and access to healthy food options, and especially in what is sustainable agriculture, and the division between what registers dietitians understand about the food systems, and also how it's a brand new concept currently happening in legislation to have doctors include nutrition in their education as well. But I very much appreciated what Riana had said earlier about needing to integrate multiple avenues of outlets like community gardens, and also including food apartheid areas in particular, because the racial differentials are very poignant in the food system, especially when it comes to the USDA and land ownership, and how very archaic patterns of behavior are still continuing, because even up until last year, 43% of Black and persons of color were denied USDA grants, but only 9% of white farmers were. And those differentials have been anchored in what has gone on continuously, and we have not interrupted those circles. So I would say that yes, really moving upstream is poignant in this conversation and something that we need to execute immediately.
Thank you so much. That was so great. Thank you. I appreciate it. Nefera Lawton from Growing Folks, I'd love to hear your points as well.
Greetings all. Thank you for having me. I appreciate you. So basically, there was so much information. I really appreciate the dietary position. I'm coming in from grassroots. I'm coming in from being a grower. We're farmers. My husband and I, we started Growing Folks. We need access to land. So we need access to land that allows us to grow for our community. We are boots on the ground. We know what to grow. We know what our people need for health. And my particular persuasion is leaned into, why are we eating? Like culturally, as a society, we've made food commodified. We've made it, colors and jingles and all these things. And our people are not necessarily connecting with why we eat. Vitamin B is really important for energy. It's really important for cell regeneration. We need to have leafy greens in our diet that's not on our hamburger. So, and the people that are going to be able to have those soft-handed conversations with the community are going to be people like myself, or an urban gardener, a community farmer, organizer. Recently through SAS here in Newark, our mayor put in a huge push for healthy eating. So for myself, I'm coming in with a food handler's license. So I'm able to be with our community, produce food, and so that's really important that we take note of those people, that integrated conversation you were talking about earlier around boots on the ground, the people who know, and the soft hand with the community. Thank you all for the invitation. I appreciate you.
Oh, thank you so much. And the boots on the ground is so important. Thank you for all that you're doing. And I want to thank all of the panelists. This has been a really energizing discussion. There's a lot that we could still keep talking about, and we'll have a chance to hear from other members of the audience in a little while. But I want to pause here and again, give a big thanks to Marion, Tambra, and Riana. I'm clapping for you. Thank you so much for being here. You can go off screen now, but if you can stay, we'd love to keep you engaged in the conversation, but I know you're all busy. So now we will shift our discussion a little bit to focus on opportunities to design food security research with that guidance from communities that we've been hearing about. More participatory research, more things that really involve those people who are doing the work every day, the boots on the ground folks. So to explore this topic, I'm joined by Erin Lentz, the Associate Professor of Public Affairs at the Lyndon B. Johnson School of Public Affairs at the University of Texas in Austin. Thank you for being here, Erin. We also have Adrian Lipscombe, the founder of the 40 Acres and a Mule project. She is also a city planner, a chef. I could go on and on, Adrian. You're a mother, you do all of these things. I don't know how you keep it all together. And we have Teresa Mares, an author and an associate professor of anthropology at the University of Vermont. Thank you so much for being here, Teresa. It's really great to have you. So I'm going to start with you, Teresa, if that's okay. And, I already brought up this idea of participatory research, which I still feel like is foreign to many people, probably not who are participating in this event. But what does participatory research look like when you're studying food insecurity and designing solutions?
Yeah, that's such a great question, and so pleased to be here with such an illustrious set of panels. I think that within food insecurity research, the role of either participatory approaches or community-based approaches are really important, because typically the tools, the instruments, the surveys that we use to measure food insecurity, measure hunger, are not designed with a whole lot of input from hungry people or insecurity themselves. And I think, in the research that I've done specifically with farm workers in New England, when we look at the main survey instrument, for example, the USDA Household Food Security Survey module, which is really what we rely upon for all of our food insecurity data in the country. If you look at the kind of underpinnings of that tool, it's about access to money equals access to food. And of course, that's a really important connection that we've talked about, and I fully support universal basic income approaches. But we don't necessarily understand the other dimensions of food insecurity, the fear of going into grocery stores, the transportation issues, the ability or inability to manage grocery shopping with other kinds of work. And so I think the more we can get insight from people who are most impacted by these issues in designing the research, that research is going to be more accurate. And I can talk a little bit about some of the findings in Vermont, maybe at some point. But I think that as it stands, a lot of the main tools that we use are just really not that relevant or appropriate for the communities that we're working with or come from.
Right. And I do want to get into this question of why we don't include those people if the research that we're doing then is not accurate. So hopefully we can come back to that, because it just seems intuitive to me, but not counterintuitive somehow to our government research program. So Erin, I'm hoping I can turn to you now. Sorry, I'm all fired the first panel. So I'm wondering if we can again switch gears a little bit here and talk about the development of your Women's Empowerment and Nutrition Index, and the ways it reflects the experiences of women's nutritional outcomes. You've worked a lot in India and elsewhere, and I'm wondering what lessons we can learn from the global South that could be used here in the global North around nutrition research and education.
Yeah, absolutely. And thank you everyone for being here. I'm loving the chat. It's great. So as Danny was saying, the Women's Empowerment and Nutrition Index was really meant to prioritize women and their spouses and other family members, and not just children. And part of the reason why this is really important when we talk about nutrition is oftentimes when we're measuring nutrition, it's either at the household level with something like the HHFFS or FSM, or we're looking at nutritional outcomes of kids in particular. And I think that it's really important to point out that we should be caring about adults too, that there's a right to food exists for everyone, not just children. And, one of the things that was really concerning in South Asia is that if you use some of these household-based measures, it might look like the household was doing okay, but in fact, what's happening is moms and their spouses are oftentimes eating less to make sure their kids are doing great. And I think that's really common. And in fact, a similar finding has been, established in the US. And so that's where you see these parallels is, people put their kids first. And I think that goes back, to the point that I think, folks were making earlier, is that, that Marion was making about people spending money on, alcohol and drugs and so on. Like, that's not really what's happening. When people are food insecure, their priorities are 99% of the time in the right place. And so that seems to me like one important lesson where we want to pay attention to what's happening within households and not treating them as a black box. The other important lesson that kind of came from this research is, as I'm preaching to the choir here, but taking a systems-wide approach is huge. And thinking about, it's not just people are undernourished because they don't have knowledge about what to cook, or they, their culture is kind of suggesting they eat different things than what others would deem healthy, or that there's, they don't have enough money. There are all these other systems kind of in place that really can hinder people's ability to kind of access the kind of nutritious foods that they want to be eating. And so doing that kind of bigger picture perspective while also paying attention to what goes on at the household level is really important, right? So it's like, how do we keep both of those in our heads at the same time? That's difficult, but I don't think we're striking the right balance yet.
Sure.
So those are two big things for me, I guess, because I can't help myself. The third one, of course, is time poverty. Time poverty is massive. And so if folks are balancing multiple jobs, it's incredibly difficult to then also come home and say, soak beans to make a healthy meal, et cetera. And I think we need to be aware that time poverty is a really significant component of people's lives. So I'll stop there.
I'm so glad you brought that up, because it was in the chat earlier that cooking, learning to cook is great. And I do think we should have more home economics classes, but there is this time poverty where people don't have the time. They don't have working stoves often, or refrigerators. They can't stock up on food like so many people. And so it's challenging. And so thank you for bringing that up. And thank you for bringing up the point about women, because they do eat least and last, not just in the global South, but also here in the United States. So thank you for bringing that up. Adrian, I want to turn to you to talk about policy, and the community work that you do is so significant with food policy councils and advisory boards, and how, the role that they play in ensuring that there is more support for improving security in communities. Can you talk about some of that work and sort of center us around how these advisory groups and councils can really be an important part of this process?
Sure. I believe, especially, I want to thank everyone in the board and the chat. It has been amazing to read and not try to jump in as much as possible on it. But food policy boards, they're diverse, or they should be diverse. And then the aspect that the people that should be on these boards have lived experiences that need to be brought forward in deciding what these policies are, what they move forward to. Because it's interesting when you're trying to translate policy to the normal citizen, and they're trying to get an opportunity to tell you exactly what's happening in the city itself, right? Because the city is supposed to be able to help move the city forward in sustainability actions, and especially when you're talking about food. And so if you have people that are on the policy board that are just mainly academic, or you have some people that are on the policy board that are mainly farmers, you are missing a whole complete other element of what's happening in the life of people. And a lot of our policy boards are recommended positions. So you're even looking at these positions being from council members are recommending someone. It's very difficult to even do that on a fact, because they're at a class, they're at a level, they're looking for intellectual people to go on this board. But
Sure.
most of the time, they are not living some of the lived experiences that we see that people are living in poverty. So they don't understand what exactly the need is. It may not be that there's not a need for food. There may be a need for transportation to get to food. There may be the opportunity that there is no healthy food within a certain parameters. How do we bring it to them? There's this whole avenue that is missed. And so if the food policy board members themselves are not in the neighborhood or not part of the experiences of what is happening, you will see things really two-dimensional in food policy boards. So you won't see the action plans really diving in deep and really understanding the needs of those community members. And that's what we really need to start focusing on, and really trying to understanding that we are not homogeneous once we become that, once we are citizens. We have to talk about culture and bringing culture in. And in fact, culture goes as far as not in just in food, but how food is grown.
Yeah.
And on the level of when they harvest, when they pick food, happens to the food, even on the teaching of how to make food. So there is this whole avenue that we really need to dive more into. And that has a lot to do with humanity, right? And the understanding that everyone needs to eat in some fashion. And how do we, which it's very difficult, even being on a policy, is make those decisions and be responsible. And part of that action is that we need to really step back and see what our city is and what a city really thrives on doing. And I'm living in one of the most most richest cities, and we still have people that are hungry.
Right.
We have people that can't get to their jobs, who cannot make money to make food or to eat. So there is a larger level than just saying creating a food policy board and make a mass overlay of what our policy is going to be for the city, because it is so deep. It is so many crevices and crusts and cores that need to be developed. And I hope people that decide to be on food policy boards realize that, you know, there is a larger responsibility just in the experiences that you have, but be willing to learn more and dive deeper and bring more people into it.
I love that. And I love that you brought up this idea of humanity and like empathy and really understanding people's lived experiences. And that leads me to my next question, I think, for all of you. So that, you know, we talked a lot about the need for data, and we do need data, and we do need all of these sort of metrics around nutrition and food insecurity. But I want to talk about qualitative research and anecdotal research, because I think that's so important, especially when we're talking about people's lived experiences. So Teresa, I'm wondering if you can sort of, you know, why have we devalued, you know, this qualitative research? And like, you know, the research that I do, which is all anecdotal, but I think it's very important, you know, so why has that been devalued?
Yeah, as an anthropologist, this is like what keeps me up at night, is the devaluing of this kind of work. And I think, you know, even our language around sort of the soft sciences versus the hard sciences, or sort of, you know, the dominance and sort of positivism that there is a truth out there, really guides, you know, a lot of our research towards more quantitative, numbers-based understandings. And I think that, you know, the work that qualitative social scientists and others that use qualitative methods have to do is to demonstrate that it is a rigorous method, that it is, you know, there is method to sometimes the madness of doing this kind of work, and that, you know, stories and narratives and experiences, to me, are just as powerful, if not more, because of the richness that they provide. And, you know, in the work that I've done, the quantitative data showed that, for example, Vermont farm workers were not necessarily much more hungry than general, you know, Vermont residents. But then the stories that I did, or that I collected through the interviews that were also part of this research, demonstrated that on paper, the numbers are saying that people aren't hungry, but the narratives of the challenges getting to the grocery store, the fear, you know, of going to the grocery store if you're undocumented, for example, are actually just as valid sort of measures of food insecurity as a quality or a quantitative approach might yield. And so, yeah, this is something very near and dear to my heart as a qualitative person.
Thank you so much. Erin, you were just constantly nodding as Teresa was talking. So can you comment?
Sure. I mean, I think just to amplify everything Teresa said, it's totally spot on. And I think one of the challenges, frankly, with thinking about a food systems approach is that, you know, probably the best way to do that, or certainly the way that I would understand how to do that, is going to be qualitatively. And so, you know, it's like thinking, as Adrian said, about like, how does transportation fit into this puzzle of why people are food insecure in a city like Austin? And it's a huge reason. But you're not going to necessarily get that if you have a survey that's assessing people's food security status, because you don't even know to ask about transportation.
Right.
And so there's this huge need for kind of open-ended kind of opportunities to listen to what community members need and what their experience, like their lived barriers are, in order to actually get a handle on what we might actually need to be paying attention to. And that's a really different starting point than trying to kind of come up with this one size fits all metric. And that's not to say a one size fits all metric isn't important for comparability, et cetera, but we're only ever going to get only part of the story that way. And that's a real challenge for all of us as, you know, researchers and practitioners, et cetera. If we don't know what the right problem is, we're not going to produce the right sorts of policy solutions.
Great point. Thank you. Thank you. Adrian, I want to ask you the same question. How do we lift up people's lived experiences and qualitative data in different ways? But I don't know how we do that. And I'm asking you to help me figure this out. How do we do that in this very contentious political environment? Austin, where you live, is just this little, sort of place, but it's in the big state of Texas, which, is a very contentious political environment. And, things can happen in Austin that can't happen in the rest of Texas or in the rest of the country or in the rest of the world.
Right. You have to put boots on the ground. I mean, you have to be part of the system. I mean, many times when I was brought in, it was mainly because of the color of my skin, right? Because they wanted me to talk to a demographic that may relate to me. But that's not also true because our culture is different. I'm different. I'm not from that area. It is creating trust and being honest and transparent in the conversation that you're having. Trust me, I believe in mixed methods. I love quantitative and I love qualitative, but I cannot do either without the other. For some unknown reason, I just have never been able to separate that. But also on the fact of doing, right? Because we are so part of our data that we get. It's the doing part. Like, what is the synopsis? What are we doing with this information? And what happens next? But I don't ever believe that study stops at just the answer that you were trying to prove or the hypothesis or the method that you got. You had to keep going, right? And you have to test it again. You have to have conversations again. You have to bring it up. You have to be willing to be flexible and organic to realize that you may be wrong in the method and the idea that you came up with. And you may just be one-sided, or you're even putting your own lived experiences in this conversation. But one thing that it doesn't capture, especially in the quantitative, is culture. It doesn't capture that. It doesn't capture those experiences in such a way that you can only hear it in the tone of their voice, when you hear them in the deflections that are happening, or you hear in the hesitation of what they're trying to give you information, or just in the screams or the talking to or the anger. Having that information really shows you a different impact of what food can mean for a community and can mean for a culture that you cannot get from zeros and ones. You just cannot. And so for me, being a doer, and doing means being on the ground and the boots and making sure this is happening and willing to make the mistakes, never means that study is over. It's willing to mean that it's going to transform and it's going to recreate. And the problem is that most of us, when we are doing some of our research studies, we're trying to get a broad answer in which everybody can understand. And sometimes it is not going to be that way. Maybe this answer just works directly for this community. And as a researcher and academic, a lot of our research and methods that we've learned were white-based, white male-based, in fact. We might as well just say that. And a lot of the people that are teaching us have not even been out into the field to do this action of their own. So, we are learning this academically from people that have not done this action. And so they are teaching us these methods in which they were learned, and then their predecessors were learned. So we have all these things where, as I come in and I'm a planner and I'm like, well, that's not how it is in this community. This is not how it is in my community. How can I prove that in the action in which the academic, but also white males, can understand this fact, in which we can move on? And most of the time it's me leaving my field to go do it.
Right.
And to go do that action on my own without the support. So there is a need for more research, especially within the minority communities, and especially for within females that are interested in the planning field or in policy, to really dive into a subject in which they are rooted in which their history is rooted in, and especially within the kitchen.
Thank you for all of that. And I love so much of what you said. Trust has come up so much during this conversation. I'm glad you brought that up again. And the idea of being willing to make mistakes. I think we need to remember that as we're talking about, everything within the food system, but especially around research, that we can take risks and be willing to make mistakes. But the way things are set up now, it doesn't allow researchers to make mistakes. You have because everything is tied to to funding that doesn't allow for that. So we need to revolutionize how we're doing nutrition and food security research. I want to thank the panelists. Please stay on the screen. We're going to have some comments from some folks in the audience, and I'd like to invite Molly Anderson from Middlebury College, who is one of the most awesome professors in the world, because I had the pleasure of being taught by her. And so I'd like Molly to say a few words if you can.
Thank you, Danny, and thanks to the great panelists for both of the panels. I want to reinforce a point that several of the panelists have made, and that's also come up in the chat from several people, that there are already solutions to the interrelated food, agriculture, health problems that are out there, but the US government simply is not paying enough attention, and not paying enough attention to people on the ground who understand the barriers to implementing these solutions, the people who are actually living with the problems. So one example, we've talked some about racial inequities and in diet disparity. There are programs out there that are addressing this, and we need research to identify which ones are really doing the best job, and not just diet-related diseases, but also food system related diseases, things like antimicrobial resistance and air pollution that comes from CAFOs, things that are being created by our industrialized food system. A second example, if we're really serious about overcoming hunger and malnutrition, let's look at the record of other countries that are doing better than we are. Some developing countries, many industrialized countries, in solving these problems. They have better food security than we do, and let's learn from them. And in particular, we need to focus on how recognition of the right to food has given rise to an array of really good programs in different countries that we should be implementing too. One more point, and this goes back to your initial question, Danny, about participatory research. We don't have nearly enough attention in this country. This is something that the panelists have not raised yet, but is really important to me. Not nearly enough attention to agroecology. We need more research on that as a food system solution, consumption as well as production. It has tremendous promise that goes far beyond the climate smart agriculture that the US government is promoting for simultaneous carbon sequestration, for soil health, for preservation of biodiversity, and for improvements in nutrition and farmer livelihoods. So these are things that I would really like to see being highlighted in this conference. Thank you.
Thank you so much, Molly, and thanks for bringing up the importance of agroecology and all of the things it does, including being often culturally relevant, because it's used in communities where they're growing things that are relevant to their culture and what they want to eat. I'd now like to invite Colin O'Neill of Bowery Farming to give some thoughts on the role of the private sector in all this, and what he thinks about what businesses can do if there is a role. Nice to see you, Colin.
Hey, thank you, Danny, and thank you to everybody who's participated today. You know, what an amazing conversation. 1 minute doesn't do it justice, but democratizing access to healthy, nutrient-dense, and sustainably grown food is certainly a pillar of what we seek to do as a company here at Bowery. And I just want to lift up a few things that have been discussed today. You know, Tambra mentioned that data informs policy and funding, and I couldn't agree more. There was a comment in the chat that poor survey instruments generate misleading data. And again, I think I would love to see nutrition and food security research focusing on the policy interventions, whether they be produce prescriptions or, you know, the system-wide view, as Erin suggested, you know, including with the lens of where individuals and families are shopping and buying their food. So that includes the full spectrum of corner stores, bodegas, you know, discount stores, often in food apartheids or rural communities. And then also was really glad to hear Riana's feedback about, you know, ensuring that data and research is trickling down to store owners and that this entrepreneurial solution needs to be included in the proposals that we're providing to the White House. Because again, business can and should be a driver of all of these things. It shouldn't be the only thing, but we need to make sure that a lot of what we're talking about makes economic sense, and that the policy solutions that we're building in, especially for greater resilience in our food systems and communities, can lift up those small businesses who want to be part of the solution, but we need to empower them with the data and the research to do that.
Thank you so much, Colin. Really appreciate that. I'd like to invite Liz Carollo of Grow NYC to weigh in here as well. Talk about boots on the ground. Liz, are you available?
Hi, everybody. Thanks so much for having me. I'll weigh in quickly. The thing that resonates most with me is just talking about participatory approaches. You have the academic side, of course, the lived experience, but then the programmatic side. I've been at Grow NYC for going on 16 years now. We have 3 models that we use for creating food access sites throughout New York City. And as of next week, we'll have 80 of those sites open after the last of our seasonal sites. But when we're doing, like Nefarist said earlier, the boots on the ground piece, when we're out there running program sites and working with we have a wide network farmer community, partnerships on the ground. We're hiring and training staff, equipment, our fleet. We're running these sites on the streets of New York, so anything and everything goes on all day long. And so we don't have the time, bandwidth, expertise to do evaluations, surveys, even implement specific metrics to collect the data, and a full agreement that that qualitative data, that is what we are collecting, all day, every day. So involving those of us who are working on the ground and implementing those programs, very, very important. And we just have a ton of frontline experience and ready to participate. The times where we have done evaluation and data collection, it's been with CUNY or Hunter, worked with or the Department of Health, worked with a much larger institution, and we're able to collect data and inform policy that way. So thanks for having me. And Adrian, I saw you at MoFad a couple months ago, and it was such a lovely night, and I just wanted to give you a shout. I'm a big fan and love following your work. So thank you all.
Thank you so much, Liz. Really appreciate it. I'm wondering if Sarah Smith Moore of Hunger Free Oklahoma can join us and talk about what you're seeing in your emergency feeding operations and how better research can maybe support that work. And again, folks, we're running over time, and I don't want to rush anyone. This has been such a rich conversation. Everyone, thanks for your patience.
Yes, hi. Thank you for allowing me to speak. I'm Sarah Smith Moore with Hunger Free Oklahoma and the Children's Council. An important piece of data that we really focus on, and I think is missing, is stories and centering the people who live this every day. Like, people are more than numbers. And when we gather their stories in a way that is not extractive, and when we compensate them for their time, their stories become invaluable. I think what a lot of us need to do is move back entirely and give others the microphone. I can sit here all day as an advocate and organizer, but my words and my story as a privileged white woman, it doesn't go far. I can list facts that Oklahoma State can save money by increasing SNAP eligibility because SNAP helps people manage chronic health conditions. But how do we know that? Through stories and numbers, but the stories are so critical. So it's my opinion, we are missing what's happening to poor and working class families simply because we don't listen. Poor and working class people are smart, they're innovative, they know how to manage the little amount of money they have. They don't need to be told what to do. And so we need to listen, add their stories to the numbers, and then hopefully we can force the US government to act on our recommendations. Thank you.
Oh, that was so powerful. Thank you so much. And you're right about poor folks being smart because they have so much to manage and so little to do it with. So they don't have a choice. And I really appreciate that and the storytelling aspect of all this. Jamie Raye of the Center for Regional Food Systems at Michigan State, I'd like to invite you to weigh in as well if you can.
Hey, everybody. Thank you for having me today. And I just love this conversation and wish that it could continue on. I'm just going to go back to what Adrian asked earlier in her question about what are we doing with this data, and what Molly had said, and now what Sarah is saying about sharing stories, and the research is already there. How can we lift up the stories from our communities, give the communities voices, and bring that research and information that they're sharing or willing to share with us, and agree that stipends are great, to lift up that information direct from the communities. Each of our communities is so unique and so different, even communities within communities. In Michigan, we have a program called Shared Measurement, where we have organizations from around the state coming together to share evaluation questions or research, and trying to whether it's prevent survey burden from our communities, and try to lift up those voices consistently with a consistent voice.
Thank you so much, Jamie. Really appreciate that. I want to thank Erin, Adrian, and Teresa for sharing their insights on all of this, and all of our panelists from the previous panel as well. All of you for joining. I apologize that we went over time. We've gone over time 6 minutes. I really try to stay on time usually, so I appreciate all of your patience. And your willingness to share your thoughts. The chat has been amazing. I've been trying to navigate it and listen at the same time. And we're going to save it, of course, so that we can incorporate it into the comments that we'll share with the White House. Your voices are essential to this process in the lead up to the White House conference. So I want to thank you all again. We will be submitting this by the deadline. Bernard Pollock, my co-founder, will not let me be late with this. The official deadline for submitting the comments is tomorrow, Friday, July 15th. And we will also share a copy of that report with all of you as attendees once it is completed. So I hope that you will continue to stay engaged around all of these issues. I know, looking at the chat and knowing all these panelists, I know you will. Elena, Food Tank's content director, will put a link in the chat so you can sign up for our newsletter so we can keep you informed of what we're doing around the White House conference and any additional updates that we hear about. So thank you all so much for your time today and your brilliance and your willingness to engage in this process. Thank you.